hot weather operations. Why you need to know about heat illness. Despite well-documented and effective techniques for preventing heat illnesses, they continue to be a threat to soldiers in the training and combat. Over 1,300 heat casualties in 2014, Army active component required medical attention and/or lost duty time. Even mild heat illness and dehydration can significantly degrade performance. The best solution is prevention. Dehydration degrades performance. Losing 4% of the body weight due to dehydration degrades physical performance 50%. This 4% body weight loss is possible in under 2 hours. Increases core body temp. Every 1% loss of body weight increases core temperature. Key terms: exertional heat illness, total body heat stress equals total heat load, and wet bulb globe temperature. While there is a range of adverse effects that can result from the body overheating, the two major kinds of heat illnesses that are referred to as heat casualties are heat exhaustion and heat stroke. Wet bulb globe temperature is more than just a basic thermometer temperature reading. It's determined with special equipment and calculated to reflect several components of an actual temperature experienced by personnel that includes air, humidity, and wind. Total body heat stress. Convection is heat transfer by moving a gas or liquid over the body, whether induced by thermal currents, body motion, or natural movement of air, wind, or water. Heat loss occurs when air temperature is below skin temperature. Heat gain occurs when air temperature approaches or exceeds that of the body. Radiation, heat loss, and gain. Heat loss occurs when surrounding objects have lower surface temperature than the body. Heat gain occurs when surrounding objects have higher surface temperature than body surface temperature. Temperature combinations of the solar, ground, and surrounding objects may exist which result in body heat gain, even if the air temperature is below that of the body. Conduction of heat to or from solid objects is usually minimal, since little contact surface is involved. Evaporation of water produces cooling. Heat loss. The max heat loss from evaporation is a function of the rate of air motion over the skin and the water vapor pressure differences between the surrounding air and wet skin. Remember, WBGT is not just temperature, includes humidity. Also, when using this chart, add 5 degrees Fahrenheit for rucksack or body armor, and add 10 degrees Fahrenheit if in MOP 4. 5 steps of heat illness risk management. Identify hazards, assess hazards, develop controls, implement controls, supervise, and evaluate. Most commonly, though, of risk factors are the climate, temperature, and the level of physical activity exertion. However, there are numerous individual risk factors to be aware of, especially consider when a single individual has more than one of the listed risk factors. The more risk factors, the greater potential for risk of EHI. Drugs that interfere with temperature regulation, antihistamines, examples Benadryl, Atarax, CTM, decongestants, Sudafed, high blood pressure medicants, diuretics, beta blockers, psychiatric drugs, tricyclic antidepressants, and antipsychotics. Note: despite certain Army policies and training documentation that has been published to date, there is currently no scientific evidence that caffeine, energy drinks, fat burners, or dietary supplements affect the body's ability to regulate heat. Identify hazards. Hot weather is a key risk factor for heat injuries. However, heat illnesses can occur under green flag temperature conditions due to previous day's conditions and/or dehydration. Identify the hazards. Heat illness hazards are cumulative. Heat category past 3 days. Exertion level past 3 days. Acclimation, other individual risk factors. Time, length of exposure and recovery time. A cluster of heat illnesses on prior days equals high risk. Lack of acclimatization. Body needs to adjust to environmental heat stressors prior to high exertion activities. Acclimation requires aerobic exercise in a warm environment. Simply being outside doing normal activities is not sufficient. Acclimatization Guide on USAPHC Heat Illness Prevention webpage for more information. The wet bulb temp index alone does not represent the full extent of the hazard. It must be adjusted or raised to address additional clothing protective equipment. Also, be aware that some persons are at higher risk, so may have heat illness at lower temps, especially if illness on certain medications or had previous heat illness. Intense activity will increase hazard. Previous high activity days and or high temp days can result in heat illness, even a moderate temperature day. Prior to a training or operational activity, leaders should prepare a risk assessment matrix like this one to determine the degree of heat hazard risk to units. High or extremely high risk conditions should be avoided. Plan in advance. Estimate heat risk level 1 day prior. Adjust activities, distances, durations, pace, and loads. Conduct high-intensity training in cooler morning hours. Ensure proper resources at appropriate locations. Functional WBGTs, water electrolytes, ice sheets, in cooler filled with 1/3 water, 2/3 ice. Medical resources, locations, communication systems. Establish SOPs, train and test soldiers. Heat illness prevention and hydration cards, and sunscreen to all. Place heat illness prevention posters and urine guides in bathrooms, bulletin boards, DFAC, training areas, etc. Identify how to monitor hydration and high-risk personnel. Take a minute to read through this work rest times and fluid replacement guide. Note, all fluids provide water, whether milk, fruit juice, etc. Are you hydrated? Take the urine color test. Note, this card is a useful field tool but is not a definitive indicator of hydration status and not for clinical use. Urine color can be affected by certain food or medications. Urine color will take some time to change after consumption of fluids or after high physical activity. Monitoring hydration in personnel. The buddy system. Assign low risk to high risk personnel. Track high risk personnel individual hydration status. Daily intake, 1 knot black bead per canteen. Use red beads for at-risk soldiers. Place water at key points. Example, at land navigation objectives. Provide and monitor electrolyte drinks and meal intake. Implement controls. Change events to minimize heat load. Avoid back-to-back strenuous days, especially category 4 to 5. Modify time of day, complete activities earlier or later. Adjust activity. Wide spacing between soldiers. Reduce pace and or distance. Breaks. Shade soldiers whenever possible. Reduce clothing and load. Uniform, backpacks, body armor, helmets, etc. Dump excess heat. Allow and provide field showers. Cool overnight temp by using fans, air conditioning, or cool showers. Supervise and evaluate. Spot check troops. Confirm battle buddy system is in place. Monitor food intake. Food, salty snack every 4 hours or less. Check Ogden cords for water intake. Are they drinking before PT in morning? Monitor urine output. Example, using the color test, and or soldiers should be urinating a full bladder every 2 to 3 hours. Ask questions that require clear thinking. What day is it and where are you? Look for soldiers who are visibly wilting or struggling. Look for soldiers bypassing controls. Example, not drinking in order to have a full canteen for an inspection. Recognizing heat-related illnesses. Heat exhaustion. Canaries in the coal mine. Need to catch these before they get to more extreme case of stroke. Catch early as they need to rest. Water, evaluation, and possible medical care. Heat stroke, medical emergency, abdominal brain function, rapid cooling, and evac. These cases can be fatal. Hypothermia, medical emergency, evac. Note, most often occurs in TRADOC IET units, especially during BCT and OSUT. Mental status changes, vomiting, history of consumption of large volume of water, poor food intake, abdominal distended or bloated. React to a heat illness casualty event. Made in the shade. Just follow these rules. Move victim to cool location. Assess victim to determine type of EHI. Decide which EHI and take proper management approach. Evaluate other soldiers and adjust training as necessary. In any case of heat illness symptoms, perform a mental health check with these questions. If victim demonstrates mental confusion, assume heat stroke victim and get medical help evacuation ASAP. Heat exhaustion versus heat stroke management. If in doubt or vomiting more than once, treat like heat stroke instead of heat exhaustion. Rule out hypothermia prior giving fluids. Heat stroke. The sooner a victim with heat stroke is cooled, the less damage will be done to his brain and organs. Soldiers displaying any of these criteria, vomiting, no improvement, or getting worse during 1 hour rest and hydration, or mental status change or loss of consciousness, may be suffering heat stroke rather than heat exhaustion. Any soldier who requires cooling with ice sheets should be evacuated to the ER. Immediate cooling is key. It can be what saves a life. However, if shivering occurs, stop ice and cooling. Remove outer clothing and prop feet up. Try to get a conscious victim to sip water and, if no indication of previous excessive water consumption. If unconscious, monitor breathing. Perform CPR if necessary. If ice sheets available, cover as much of exposed skin and top of head, but not face. Change out sheets when they get warm. Remove if victim starts to shiver. Some installations only have clinics instead of hospitals. Some have no emergency room. Some units have no organic ground ambulance support. What are alternatives? Medical professional training others on heat injury evacuation decision guidance. Most important training is how to cool down the soldier. Ice sheet treatment. Always carry ice sheet, example 8 sheets per company in a large ice water cooler. Note, wash wet sheets and clean cooler daily. Coordinate for unit transport of non-military ambulance support, garrison or off post. What support can they provide? What is their level of training, and do they have gate access? Conduct tests to ensure 100% communication. Cell phone, dead bones, radio interfaces. In summary, we covered EHI remains a threat to soldiers and mission. 5 steps of heat illness risk management. Recognize heat-related illness, EHI, heat exhaustion, heat stroke, water intoxication. Know what to do. For additional information, links to the Army policy statements, heat injury references, TRADOC policy, and heat injury prevention products are available on these websites.